Hi, I'm Marty Nemko. I believe this mock career counseling session offers lessons not just for healthcare providers, like doctors and nurses, but also for others, like lawyers or social workers, teachers, as well as for counselors. The client says, I'm a little embarrassed to be here. I mean, I'm in one of the most prestigious and lucrative professions. I'm an MD, and I have a full practice. But I'm wondering if I should stop practicing. Why? It's hard not being sure if my diagnosis or treatment is right, and some of my clients come in having done so much research on their condition. They come in waving printouts and implying they know more than I do, and sometimes they're right. And the paperwork, it's overwhelming. And then after I do all that, the Medicare or the insurance cuts or even denies the claim. Anything else? I feel guilty for feeling this way, but I get so frustrated with patients who are obese or smoke or they do drugs. They won't take their meds, even if it's serious, for diabetes or heart disease. And no matter how tactfully or how forcefully I try to encourage them, they rarely do. More often, they just don't show up for the next appointment. I mean, not all docs are so frustrated. I feel like such a loser. I've looked at every damn way to use my MD outside of clinical care, and nothing appeals or it's unrealistic. I'd love to teach in medical school, but so would the zillions of other unhappy doctors. I didn't graduate from Harvard. I haven't published a sheaf of journal articles. And my patient reviews, they're okay, but they're not off the charts. And I don't want to be a hospital administrator. I don't want to work for a drug company. And if writing patient information documents pays next to nothing. I got a wife, 2 kids, and all the accoutrements that come with the lifestyle that a doctor's family expects. I'm trapped. I'm goddamn trapped. Are there any tweaks to the way you practice that you haven't tried or should keep trying? I've stopped seeing patients who are so frustrating. I kept replacing my billing specialists until I found someone good, and I pay her well. I treat her very well. But it's not enough. Too often I'm scared or frustrated during the day, and I'm exhausted at night. I'm sure you know this, but the best ideas usually come from the client, especially a smart, sensitive person like yourself. So imagine that I didn't exist and you had to give yourself advice. What would it be? I have to stop with the God complex. You see, until I went to med school, I looked up to docs as gods. They were people who were really smart and worked really hard and they saved lots of lives. But the gods have been toppled. Docs are human beings. Yeah, they're smart. Yeah, they're hardworking human beings, but they're still fallible. They're human beings, sometimes very fallible. I've even used my access to get some opioids. Actually, that's when I realized I better see someone. I'm glad you've come. And the field of medicine is so young still. There's so much we don't know. Yet we're expected to do more, ever more, faster, with the system charting our efficiency. I've got to recognize my limitations, even that I'm not the most brilliant, intuitive, let alone always in control, Doc. I'm still not a piece of crap. And if that doesn't work, I need to cut back. Screw the efficiency metrics. See fewer patients. Take more time to chat with patients, even if the appointment exceeds the goddamn 12-minute standard. Or maybe I need to cut back to shorter work days. But there's a piece of me, a big piece, that thinks I need to get out of medicine, like open a cafe or something. Do you want to play devil's advocate regarding that plan? I don't want to be like one of my non-compliant patients, but to tell you the truth, not now. I'm tired. I'll think about it all. Forgive me. Absolutely no apology necessary. Would you like to schedule another appointment? Okay. And I promise not to be a no-show. Anyway, I thank you for watching that little mock career session. Hope you found it valuable. Feel free to give it a thumbs up, thumbs down. Comments are very welcome. Share it on your social media. Subscribe to my channel. In any event, I do thank you for watching. I am Marty Nimco.